Welcome everyone to our second menopause chat featuring Dr. Melanie Ohalski and Guinevere Crescenzi. WellSpan offers a full complement of women's health services. We are here to support you through your whole journey, from annual women's well visits with preventative screenings through pregnancy, the birth of a baby, and beyond. Tonight, we will focus on the beyond as we learn about navigating hormone changes in menopause. This is Sue Dalla, Women and Children's Services Outreach Coordinator. I am here to assist Dr. Ohalski and Ms. Crescenzi throughout this evening's discussion. This chat is being recorded. If you wish to be anonymous, please change your name, which will appear in the list of participants on your screen. We want you to be an active part of this evening's discussion. Your video and microphone features are turned off, but you are able to ask questions and send comments through the Zoom chat feature located at the bottom of your screen. Once in the chat window, excuse me, please click on the drop-down arrow in the recipient line and choose my name. I will review and share your questions with our host or respond directly to you via the chat feature. If we have not responded to you by the end of the discussion, please stay online and I will message you through the chat feature. Before we begin this evening's discussion, we thought you might like to see the feedback we received from last month's chat participants. Your feedback and suggestions are important as we plan and enhance our discussions. You'll receive a new survey link tomorrow, and we hope that you will all consider giving us just 2 minutes of your time to let us know your thoughts. Thank you to those who responded to our survey request last month. I'll give you a few moments to look over the results. Popularity of topic requests and comments are on the next 2 slides. Okay, let's review the results. Although there were a few who would have preferred the time of our chat to be earlier or later, the majority found that 6:30 p.m. works well. Your feelings about the length of our discussion being just right, it being a positive and valuable experience, and your interest in taking part in future chats were unanimous, which was wonderful for us to hear. The ratings and comment sections were also affirming and indicated what we can improve moving forward. It was very interesting to see which topics generated the most interest. We will be discussing them all in upcoming chats. Again, take a few moments to check out the results. It was a little reassuring to me to note that brain fog and memory loss were high on the list for many. I'm personally looking forward to that chat. Some of last month's participants had not realized that each chat will be topic specific and may not address some of the concerns that fall outside the current month's focus. We apologize for that misunderstanding. Please know that your questions and concerns are all important, and there will be an opportunity in other chats to discuss issues that do not apply to the current topic. Thank you for sending us your comments and suggestions, 3 of which are shown. Please take a moment to read through them. The first comment expresses exactly what we hope to achieve. Our new process regarding how your messages will be reviewed and addressed will, hopefully, take care of the second 2 comments. We'll do our best to respond to your messages in a timely manner, but please be aware that many messages may be coming through at the same time. If you have an immediate concern that falls outside the current discussion, please identify yourself in your message so that we can respond to you privately by email within the next 24 hours. Dr. Ohalski, I am going to turn the evening over to you.
Well, welcome everyone to tonight's Menopause Chat. I'm Dr. Melanie Ohalski, a reproductive endocrinologist and certified menopause practitioner at WellSpan's Midlife Center. And tonight I am thrilled to be joined by one of my favorite people, Guinevere Crescenzi, who's an acupuncturist at WellSpan's Center for Mind and Body Health. Thank you so much for being with us tonight.
Thank you for inviting me. I'm really honored to be here. I'm very excited. I work at the WellSpan Center for Mind Body Health, like you just said. And I went to school, just to give you guys some background on me, I went to school, my undergrad was at Pitt, and then I went to Thai Sophia, which has now changed its name to the Maryland University of integrative health. And from there, I came to Pennsylvania and started pretty much like working at WellSpan about 2 years after. I had a private practice for a little bit. And I love helping people with menopause. Oh, acupuncture. A lot of people have questions about what the heck acupuncture is. So acupuncture is a piece of Asian medicine that is one of the 4 pillars of how we can keep ourselves healthy and well. Nutrition, right living, acupuncture, and then there's herbs, which is the next level up if acupuncture kind of isn't enough to get you back in balance. But the right living and exercise and art actually are really good things that we can all do even prior to coming to an acupuncturist to get guidance on how to get back in balance. And with acupuncture, I use very, very thin pins that only go in a teeny bit into the skin. You can feel a little prick when it goes in, but I use them to access acupoints, which are specific energy points on the body that do specific things to help rebalance how our energy is moving. So put those in, you take a nap for about half an hour, and the pin should never feel to such a degree that you couldn't fall asleep with. So I make sure you're comfortable, dim the lights, turn on music, you take a nap, I come in, take them out, and a lot of people feel better pretty quickly. So that's pretty much my shtick.
Well, I can attest to the many, many patients and women that you have helped. So we're going to talk more with Guinevere a little bit later about how we can specifically use some of her therapies for some common menopause symptoms. But as Sue mentioned, tonight's topic is navigating hormone changes of menopause. This is the second of a series of menopause chats where we'll discuss a topic related to menopause, and I am looking forward to your audience participation. So as Sue mentioned, you'll be able to send your comments and questions to her, and we will try to answer as many as we can tonight, so that as much as we can make this interactive, we hope to do so. One of the most common things that my patients tell me at their initial office visit is, I just feel like my hormones are off. And tonight we're going to find out why that might feel that way and what we can do to help. Sue, can you pull up the first slide? I only have 2 slides, but I think that this might be a little bit helpful. So for most of our early adult life, women become accustomed to a predictable pattern of hormone changes throughout the month. And then when we enter a phase called the perimenopause, our hormone levels can become more erratic. And for most women, this occurs in our 40s. And during this time, the hormone peaks can be higher and more prolonged, and the dips in our hormones do the same. They can be a little bit lower and stay a little bit longer than they had done previously. And so when these hormone changes happen, we may develop changes in our bleeding pattern, we may develop mood changes and sleep disturbances. Then we enter the menopause stage, and that's in the far right part of this slide. So that's when our ovarian hormones are more consistently low. And the symptoms that are common during this phase include hot flashes, sleep disturbances, and mood changes, among others. Very often in my practice, after patients tell me about their symptoms, they say 2 things. One is, well, it's just hot flashes, with emphasis on just. It's just hot flashes, I can tough it out. Or I'll hear menopause won't last that long, so I'll just tough it out. My mom did, my grandma did, so I don't need to do anything to intervene. And the take-home message that I would like to leave you with is that many symptoms, if they're severe, can be associated with other health issues, and menopause symptoms can last longer than most people think. And so I want you to leave here knowing that there's really no reason to tough it out, and I'll tell you why. So if you can pull up that second slide. Okay, and so the purpose of this slide is to kind of give you a sense of how long we are in our menopause or postmenopause phase. If you consider that the average woman will become menopausal when she turns 50 or 51, and the average life expectancy of women is 82 years of age, women will spend over 3 decades of their lives postmenopausal. So to say that another way, 30% of our lives will be spent as postmenopausal women. So it's not, we don't want you to tough it out for a time of your life where we hope that you're living your best life. So in menopause, about 80% of women will have hot flashes. Not all will be severely impaired by them, but the majority of women will get them to some degree. And hot flashes usually go away after about 5 to 10 years. The average duration is about 7 years.
Can I add something here?
Please.
So what's really interesting, well, first of all, from the Asian medical perspective, we absolutely have a good bit of control over our experience of these symptoms. And I'll get into how we can control them, but that's another reason to not tough it out, because generally speaking, as an Asian medicine practitioner, I believe that our body is speaking to us. So any symptom that we have is a teaching symptom. And what that means is like the body is speaking to us in a way that we don't like, because that's how we listen to it. But we often don't know how to interpret what it's saying. So we know it's screaming, we know we don't like it, but we have no idea what to do. And so that's where acupuncture can come in, and we can try to figure out what this message is. And it can be different for everybody, and we figure it out. But the point is, we can figure it out. And then if you kind of obey what your body is telling you to do, that won't be, you don't have to suffer. Like, you can figure out how to not have hot flashes, or how to way reduce your experience of them in severity or frequency, both, depending on how you learn to modify your behavior in a way that your body finds more agreeable. The other thing that really caught my attention is the 7 years. So in Asian medicine, women have 7-year cycles. So from 0 to 7 is, the childhood. 0 to 7 is one phase of early childhood, and then 7 to 14 is the next phase of early childhood. And generally, most women menarche by then, which have their first period. And then like straight through until, until we're done. We go in cycles of 7. Putting us at 49 is, in Asian medicine, about when we would expect menopause to, or at minimum perimenopause, but menopause pretty much sets in around 49 according to Asian medicine. So the fact that it often lasts, from the Western perspective, about 7 years makes perfect sense from my perspective. So that's interesting.
Yeah, it's very interesting when Western medicine jives and has consistencies with.
I love it. I love it when they match up, which happens a lot. it's just neat to see.
I agree. So we're going to pick your brain more about some more of these therapies and how they can apply to menopause women. But what I want to mention is that while hot flashes are very common, not all women will be severely affected or distressed by them. But those women that are can see changes in their quality of life, their sleep, their cognition, and their mood. Hot flash can affect how we interact with our family, our coworkers, and friends. And because of that, we can see increases in depression in women who are severely affected by hot flashes. And we also have recently found that hot flashes affect the lining of our blood vessels, and so may increase the risk of cardiovascular events. And so the point that I'm trying to make is that these are really not just hot flashes. So if you are someone who's affected by them, then this next part will be really important because there are very safe and effective treatments. So first, I just want to briefly explain from a Western physiologic standpoint why hot flashes occur. When our bodies, for most of our reproductive life, become accustomed to a certain level of estrogen. And then when we are menopausal and our ovaries aren't making much estrogen at all, that affects our thermostat in our brain. And so the part that controls our temperature regulation suddenly becomes overreactive. And so small temperature increases can make your body think that it's on fire. And so you start to sweat and flush and feel very hot. And the good news is that you have some control over this.
Mm-hmm. And it's really very similar from the Eastern perspective. We have this concept that a lot of people are aware of, yin and yang. Mm-hmm. And so the yin is the cooling, slower, dark. So think of like winter versus summer weather. So the yin energy and then the yang energy is the hot, active, summer versus winter energy. And so we all have both of them in our body, and we like to have them at a relative balance. As we age, we naturally use up our yin just over the course of life. We use up our yin, and at that point of about 49, depending on how we've lived lifestyle wise, we can have very little yin left, or we could have an abundant amount of it. And if we have very little, then we still have likely about the same amount of yang, that hotter energy, but now we can't cool it. So our temperature regulation isn't, it's not like confused at all. There just doesn't have the ability to cool it down the way it used to. And that, and there's very little, like drinking a hot cup of tea or having an argument or just running around and being stressed at work. All of these are things that can trigger a hot flash, because it's not that you're actually hot with real heat. It's more that you're just not able to cool down. And so what we can do is increase the amount of cooling activities in our life, and foods, and kind of the way you're moving through the world. All those things can increase your yin, which will then work to keep the yang in check, and your temperature will be have more of an equilibrium. Does that make sense?
That is it's really cool. So if a patient wanted to learn more about what foods to avoid and what foods would be more beneficial at decreasing the amount of hot flashes, where can she go to get that info?
honestly, really even just Googling it is fine, but obviously make an appointment with me or any Asian medical practitioner, and we could direct you. But also just as it's not super complicated either. So anything that seems cooling or damp is probably going to be a good useful thing. So eggs or dairy, oils like olive oil, avocado, black beans, all of these things are cooling versus garlic or chili peppers or ginger, things that are like kind of sharp and kind of like make your eyes water. Those are going to be not cooling. And so avoiding those, particularly in a hot season, would be better because they'll dry you out more. Coffee, alcohol, things like, so stimulants, those things are drying as well. Water, the first thing you should do is make sure you're drinking a ton of water to make sure you're well hydrated. At least the 64. I like it when people are drinking at least 80 ounces of water a day. That just first line of defense to be cool is drink adequately.
And what I usually suggest is to carry around not just water, but ice waters, because when your hand is touching something cool and then you're ingesting something cool, it literally can help cool you down and prevent a hot flash.
Yeah.
Ladies, I'm sorry. I have a question from one of our participants. Is red meat not a cooling food? She has an aversion all of a sudden to beef.
Red meat or red beet?
Meat, M-E-A-T.
I'm not positive about that. I don't think that it's not cooling. It might be more neutral. Lamb is hot. You'd want to avoid lamb. Pork, I'm not positive about. So seafood would be the most cooling. And chicken and beef, I think, are more neutral.
But I would imagine that if you did an online search for cooling foods.
Yeah, I would say yin, Y-I-N, yin nourishing foods brings up a decent list.
Okay, so these are some lifestyle changes to be cognizant of that can help offset some of the symptoms that happen. So food changes, and we didn't mention that dressing in layers, avoiding getting overly heated. At night, I suggest sleeping with as minimal clothes as you can, definitely without socks. Keeping a fan pointed at your feet can also be helpful.
Also, really look at how you're moving through the day. Are you rushing around? Those like rushing and stress uses up your reserves. So the more that you can be relaxed and calm through your day will go a huge way to helping you have less of an experience of hot flashes. And I definitely recommend gentle exercising like yoga, tai chi, qigong, something relaxing, but also that it gets you moving would be very good. Regular walking is always a good idea, but then also meditating, taking time to read, being peaceful, feeling like you have enough time and space for yourself is very, like your body will respond to that and lower your temperature. It will have faith that you're going to be okay and that relaxing helps you stay cool. Definitely meditating, regular habits in terms of eating at predictable times, having your last meal of the day be earlier in the day than later in the day, and a light meal versus a substantial meal, that is very helpful. But predict as much as predictable times as you can, and taking time to sit and savor your food. Not eating at your desk, not eating in the car, rushing around, but really like taking time to slow down. My main takeaway is slow down, because if you're moving more slowly, that is in harmony with yin energy, and that will supplement your reserves and in general just help you to not experience the hot flashes from the yang energy not being able to be held down.
And so when doing when making those changes, implementing those strategies are still not completely effective, how then can acupuncture help in that situation?
In acupuncture, we look at, we don't treat one particular Western diagnosis. So you may be diagnosed with hot flashes, but if you come to me and say, do you treat hot flashes? I will say no. But what I do look for is a pattern of disharmony. So that's what we call a diagnosis. Okay. And we look for a constellation of symptoms that altogether will indicate what's going on with in your body, which I think of as your own personal ecosystem. Like each of us is a little natural system, and certain things go off in certain ways. So there are generally 3 patterns of disharmony. So I would differentiate between what is going on more particularly for you, and say if you've got hot flashes that are accompanied with occipital headaches or dizziness, that means we would need to bring in a little more of the spring yin energy. And I would give you advice for that, it'd be tailored more specifically. And where I put the pins would be more particularly tailored to what exactly was going on to realign the energy movement.
So it's individualized.
Yeah. Right. Generally, they're the 3 different ones. That's it.
And if a patient was considering acupuncture, what is the frequency of appointments? Is it usually once a week? And then
it depends on how severe the person is being affected. So it's very patient dependent on because any level of acupuncture is good to get. So if you're only going once a year, that's fine. But if you're very severely affected by what's going on, anywhere from once a day to, well, like once a year. I've had people come once every 4 years. But so it just depends on what you need. And so if you're bothered terribly, typically I will say once a week. And that would be, and then we would watch and see how big an impact the acupuncture is making. And that'll depend on what you're doing lifestyle wise, as well as how much I'm able to correct the energy movement in your body. So it's definitely a partnership in that. And, but mostly speaking, coming for weekly visits, after about 6 visits, most people have at least a half reduction in the severity and frequency. Some people do much better, and some people don't see many results at all. So that's, you need So it's always an investigation to see how much it'll help.
Right, which is consistent with some of the therapies that I generally use with patients, where we'll initiate a treatment and then we're looking to see at least a 50% reduction in how many hot flashes you get and how severe they are, to know that we're on the right path.
Exactly. And if I'm not getting the results I'm expecting, I look again to see, like, oh, maybe this is this is also liver yin disharmony, and I've been treating this other disharmony,
Right.
like, just to see, like, so we tweak it to see what am I missing here.
And often patients will come to me and ask me about supplements. There are so many supplements that are available today, and you could hardly turn on your radio without hearing a commercial for the newest menopause or midlife supplement. So it's understandably confusing sometimes and overwhelming about which ones might be best for you. Many of the supplements that you would commonly find in the supermarket or in a health food store contain soy, which is a plant-based estrogen. Black cohosh or Chinese herb blends are also very popular. Some of the supplements out there can be very pricey, and because they're not regulated by the FDA, the components aren't always verified. And for most of the over-the-counter products, there hasn't been one that has been shown to be better than taking a sugar pill. So I would caution you at home about what you try and how long you're going to try it. If I do have patients who have found something over the counter and they're taking it in what seems to be a reasonable fashion, and so I don't want to take that away from anyone out there, but I would just offer a word of caution before jumping into something that has a big expense and may not be safe. I would consult with a specialist about that.
Dr. Opalski,
Yeah.
Excuse my interruption again. Is there something specific that can be done when you wake up in the middle of the night drenched in sweat and you want to go back to sleep? I know we're not talking about taking a medicine or anything, but can you just recommend a way that someone could fall back to sleep?
I can. So unless
Go ahead.
generally a lot of what Guinevere and I would want to talk about today is preventing you from getting to that point, because that can be very disruptive. And when you're not sleeping, you're not waking up feeling well rested, it colors the rest of your day. So good sleep is hugely important. When you're getting good sleep, you are less likely to have a hot flash, because hot flashes rarely occur when you're in that deep, good phase of sleep. So preventing getting to that point is numero uno. But if you are woken up, my advice would be to first don't overreact. Many times we wake up and now we're bothered. I'm hot, now I'm awake, I'm not going to be able to fall asleep, it's going to make me tired tomorrow, and now everything is ruined. And so we quickly escalate and make what was not a good situation an even worse situation. So if you remain calm, you recognize that it's going to pass and that you're going to fall back asleep, and just repeat those reassuring words to yourself. That would be my first advice.
That's 100% what I would say. Like 100%. I immediately, you want to accept the situation. Remember that this is your body speaking to you. Your body's giving you a message, and acknowledge that. And it's nothing that you did wrong, and it's nothing that was done wrong to you. and just be at peace. And the quickest you can find your peace with it is like, it is what it is. And just like name it in terms, like just say, I feel wet, I feel cold, I am tired. Let's just name it. And staying as calm as you can, because just like we were talking before, that you can trigger a hot flash by being stressed. Mm-hmm. And so you can just really compound the situation very easily. And the way to not do that is staying calm. And if you've developed some meditation practices that you can just go straight into, yoga nidra, NIDRA, is one form of meditation that is lovely. If you have like something queued up that's easy to get to start playing a yoga nidra, so you can just listen to it and follow its prompts. It's basically sleep yoga, so it can put you to sleep really beautifully. And so that would be my first line of defense. But that's exactly, we really said the same thing.
Yeah. Now, if you're using these strategies and you are still having severe disabling hot flashes, and so for me, disabling means that your life is affected. You're not sleeping well. You're starting to avoid even wanting to go out because you're dreading the next hot flash. Then there are prescription therapies that can help with hot flashes. And modern hormone therapy is much safer than the hormones that were used 20 or 30 years ago. Most of my patients that are on estrogen are taking the same molecular structure that their ovaries used to make. And most of the time, it's a regimen that is applied topically, either by a cream or a patch, so it's absorbed through the skin. And from a Western medicine standpoint, since hot flashes are caused by a lack of estrogen, then replacing the estrogen is what we consider the gold standard for treating hot flashes. And it's not that therapy is not for everyone, but estrogen also has some other benefits, which is keeping our bones strong. Women have the most rapid loss of bone strength the first few years after their last period. And estrogen prevents that loss of bone. The other benefits are related to the fact that there are estrogen receptors almost everywhere on our body. And so many women notice other benefits of taking estrogen as well. So let me stop talking and let you guys lead the conversation with questions that you may have at home.
Oh, and I did have just one other perspective from Asian medicine about menopause. The perspective that I have is that it's a completely normal part of life. It's not pathology at all. There's nothing wrong or that needs to be stopped. And the idea of menopause is that instead of pouring energy, our life energy, literally into our uterus, that since we no longer need to do that, we pull that back, and it comes back to our heart, and we're able to use that energy that would have gone to the monthly cycle for the betterment of our body to have a more vibrant next 30 years. So we're kind of taking our energy back for ourselves. And there's also this idea that we're no longer a mother to particular children, but rather we've become so wise. And at this point, it's important to become the community mother, like the wise woman of our domain. So I like that more. I feel like it's a more empowering view of what's happening. So not so much as a loss as a regaining for ourselves.
Okay, ladies, I do have some questions. You're talking about hormone replacement therapy, brought this one up. It says, can hormone changes with menopause cause atrophy in the urethra? I've had my urethra dilated in the past 3 months, and my GU provider is blaming a decrease in estrogen. How common or concerning is that? And what are the recommended treatments?
That's a great question. And I'm glad that you asked it, because there are many symptoms of menopause, but almost all of them will either go away or have a rebound. But there are a few that persist and progress. One of them being our bone loss, and the second being the changes to our genitourinary system. So our vagina, our urethra. Without estrogen, there are changes in that tissue that does progress, and it can cause several symptoms, including vaginal dryness, pain during intercourse, increased risk of bladder infections. So that would be a common symptom to have. Most women don't have it to the extent that they would need urethral dilatation, but patients that may have urethral issues may have an exaggerated or exacerbated symptoms when they go through menopause. And for many women, that can be improved by taking estrogen. In that situation, though, we use estrogen locally. So you don't need to take it so that your whole body gets it. You can just apply it to the local area. And the risks of doing that are different than the different risks that you may have taking estrogen so that it gets to your whole body. Anything else you would add?
I don't, other than it's just, so since with Asian medicine, I don't treat any specific thing. What it looks like to me is just the drying, and like the lack of adequate moisture and cooling. So I'll say that Asian medicine is very simple when you get down to it. Things are either hot or cold. And so that would be an example of there's not enough cold and moisture.
Any other questions, Sue?
Yes, we have quite a few questions related to HRT. So I'm just going to read a couple because I think you can address them all pretty much at the same time.
Great.
Is hormone replacement safe for someone who has had breast cancer? Would you advise women who have a family history of heart disease, heart problems, to not use HRT, and why? I've never heard about HRT being problematic regarding the heart, only possibly cancer causing. Let me see. I think there was another one. Oh, yes. For those who suffer with endometriosis, how would you help them when they produce excess of estrogen, and estrogen therapy is helpful for hot flashes?
Okay, those are great questions. Hormone therapy has evolved a lot over the last few decades. And that's partly because we have a lot more data than we did 20 or 30 years ago. And we have better regimens to give patients. When I'm talking with a patient about the risks and benefits of hormone therapy, the two biggest risks of starting hormone therapy are the risks of developing a blood clot, so meaning a blood clot in your legs or lungs, or developing a heart attack or stroke, and the risk of a breast cancer. The risks of the blood clot that can lead to a stroke or a heart attack are very specific to the type of hormone that you're using, so where it comes from, how it's given, whether you're taking it orally or you're placing it on your skin so that it's absorbed directly into your bloodstream. and how long it's been since you've been menopausal. What we know is that for the average menopausal woman who is experiencing hot flashes, who is otherwise in general good health and is less than 10 years since her last period, the cardiovascular risks of starting hormone therapy are quite low, are very low, in fact. And so we can accurately predict the risks, and we do that by using your blood pressure, your cholesterol level, and then we can determine whether you're a candidate or not for hormone therapy. But for most patients who are symptomatic, using the right formulation is very safe. The risk of breast cancer is related to the fact that some breast cancer cells will have hormone receptors on it. And so taking extra hormones can be like a fertilizer to that cancer cell. And so most patients that have had a history of breast cancer, whether or not it was hormone sensitive, would not be candidates for hormone therapy. Now, there are other non-hormonal options for hot flashes, but usually we try to avoid any hormones in case there are any cells there that could be stimulated by a hormone therapy. Many women who have never had a breast cancer themselves worry about the risk of taking hormone therapy for them, of developing a breast cancer. That risk is still very low, though. So for the average patient who has never herself had a breast cancer, generally she would have a 1 in 10 risk of having a breast cancer. Taking hormones would increase that risk to 2 in 10. So there is an increase in that in breast cancer risk. However, that risk is equal to the risk of having a glass of wine every night or being above your ideal body weight. And so we rarely hear on the news that if you're 10 pounds overweight, you have a significant increased risk of breast cancer, but we often hear that hormones are very dangerous. And so putting that risk in perspective is important. When a woman, if she is diagnosed with a breast cancer and she goes off of her hormones, her cure rates are very favorable, so it doesn't worsen your prognosis in any way. And many women are on hormones for a defined period of time. And once they go off the hormones, their risk of breast cancer goes back to the baseline. It doesn't forever stay at the 2 in 10 risk. So someone had also asked a really good question, which is the risk of heart attack or cardiovascular, the cardiovascular implications of being on a hormone therapy. And that's a really interesting question because we know a few things. We know that women generally have a lower risk of heart attack compared to men until we hit menopause. And then when our estrogen levels go down, the risk of heart attacks goes up. So we know that there's something protective about hormones and specifically estrogen. But we also know that for some women, being on estrogen can increase their risk. And so that goes back to the relationship between how long it's been since a woman has been menopausal. There is ever increasing data that being on hormone therapy can be protective, but we are not yet at the point where we are recommending or there is strong evidence to preventatively put patients on estrogen. And so what I would say from a heart attack risk is that being on hormone therapy is probably risk neutral. It, for most women, will not significantly increase the risk of heart attacks, but we're not at the point now where we can say it'll lower your risk. So I could talk for a long time about that topic. I hope I answered your question though. Any other questions, Sue?
I have some others. They're still on topic a little bit. I just really found them interesting since we are talking about medication. I did have someone ask if taking sertraline for hot flashes is a good idea. And then someone else asked about, have you found antidepressants to help alleviate menopause symptoms? So there we go.
Okay, that's a great question. There are some non-hormone prescription medications that can be as effective as estrogen at decreasing hot flashes. And one example or one type of medicine are the mood stabilizers. So the medicines that are typically prescribed for anxiety and depression. Not all of the medicines that are used for anxiety and depression help with hot flashes. So sertraline, as an example, can help with hot flashes. It's not one of the medicines that are particularly strong or potent for hot flashes, but there might be a small benefit to them. So if a patient is not already on a medicine, we'll try to use one that has is stronger at preventing hot flashes. And there are other options that are non-hormone prescriptions for hot flashes. And so talking with your doc about what some of those options might be can be helpful, because some patients cannot use hormones or they choose not to use hormones. And so there are other options, with the mood stabilizers being one of them. And then I'll add one other thing. Sometimes patients are on a mood stabilizer that's not particularly effective for hot flashes. And then in that situation, we can sometimes work with the patient's PCP or psychiatrist and safely change to a medicine that can have more hot flash coverage.
Dr. Ohalski, that lends itself to another question along the same lines. This participant did not have hot flashes for very long, and she's wondering if it's normal. And she said she actually feels cold more, but her main concern is that her moods are very different. She was never a very angry person, but she finds that she gets to that point more quickly now.
Having mood changes around the time of the menopause transition is not uncommon, and it can sometimes be tricky to know whether it is the hormones that are pushing that or driving those changes versus there being underlying mood issues that the hormone changes then just exaggerate. But the first point is it's not uncommon. And then second would be accurately finding out what is the real cause and then coming up with a strategy. And I can feel Guinevere thinking about what she would like to add to this, because I think there's probably a role for
so I said earlier, there are the three different patterns of disharmony that I typically see when somebody is coming in saying that they have hot flashes. And one of the patterns is that has to do with the kidney yin and yang deficiency. And that one, so in that one you have cold. That's the only one of the three so the deciding factor with that one is the person is experiencing cold. And so then we need to supplement both their kidney yin as well as their kidney yang. So it's just a different diagnosis, which would lead to different lifestyle recommendations for how to come back to balance with that particular condition.
And so what I would also add is that sometimes during this change of hormones where we are becoming more symptomatic, it can start with that small change that then affects our sleep, and then we're irritated, and then our mood changes, and we have less energy to exercise. And so what I commonly see is that one issue snowballs into a big problem. And so I think recognizing that something's not right with you, and then first focusing on the basics, which is eating well, getting good sleep, having stress release, having me time, working on that. And then whatever is disturbing those things, so whatever is stealing your peace, whatever is disturbing your sleep, trying to decrease that. And then if that's not making a dent in it, I would seek out the help of your doctor. We have the midlife center. We have great acupuncturists
And therapy.
And yeah.
Phil Haven is a huge resource. And I don't, it's not necessarily easy, these and generally if our body is speaking to us with whatever symptom, it's throwing up that flag because it isn't an easy thing. Like and we've ignored it for however long we've ignored it because we don't want to do it the other way. So it's not that the answers can be very simple, meaning they're not complicated to understand. They can be difficult to implement. And really, I just don't want to take that away from anyone. Like this is challenging stuff that thousands, millions of women struggle with. And there are reasons that we struggle with it. And so definitely getting support in figuring out what you need to do and how to help yourself make that transition is really, it's just necessary. And there's no shame in that. I just wanted to make sure that was clear.
Yeah, I think that's a great point.
Ladies, our participants are very happy with what you're sharing with them. Can we take just a little step backwards to what we were discussing before? This one is Dr. Ohalski mentioned effects from menopause on the cardiovascular system. Should people with chronic hypertension that's treated with medication be more cautious and keep a closer eye on their blood pressure?
Definitely yes. Controlling blood pressure is an important way of decreasing the risk of having a heart attack or other life-changing diseases. And so that comes back to optimizing your overall health. That's for sure beneficial. Should patients that have a history of high blood pressure be more or less likely to use hormone therapy? Well, that's a good question, and it really depends on the specific patient. A patient that has high blood pressure, but it is under control, can safely use hormone therapy. A patient that has high blood pressure shouldn't use hormone therapy as a way of trying to control their blood pressure because that's usually not effective. And so I hope I answered that accurately, but I think the take home would be to talk with your your clinician to make sure that you are optimizing your health so that you can live this phase of life to the best of what's available. Sue, what if we take maybe another question or so? And while I'm giving you all time to respond to that, let me put in a plug for our next menopause chat, which will be October 6th at 6:30 p.m. And October, as many of you know, is Breast Cancer Awareness Month. So in our October chat, we will be talking about breast cancer and how to decrease your risk of that. But we'll also be talking about the top 5 cancers that affect women and what we can do to decrease those risks and look out for signs that we might be at higher risk for them. So I hope that you will join us for that menopause chat. And Sue.
Yes, I did have someone who had mentioned earlier about endometriosis.
Oh, yes. Thank you for reminding me.
Sure.
Endometriosis often will, the symptoms will decline during, as a woman ages and gets closer to menopause. And the reason that happens is because estrogen feeds the endometriotic implants. And so as we make less estrogen, often the endometriosis kind of burns out a little bit. And so for many women with endometriosis, they don't need to be treated or handle the menopause transition really any differently. But there are some exceptions to that. And sometimes, depending on the severity of the endometriosis, how recently a patient has been symptomatic, and other factors, we do tailor their treatment accordingly. So that endometriosis is a really interesting disease, and for most women in menopause, it is not a huge issue, but it's taken out as a case-by-case basis. I am so fortunate to have been joined today by Guinevere. Thank you for spending your evening with us. And thank you at home for joining us this evening. And the reason why I'm passionate about midlife medicine is because it's a wonderfully exciting time of life that can present challenges that once you get over them, you are the better for it for the most part. And most people listening will either be going through some of the symptoms and changes that we've talked about or love somebody who is. And so please know that there are a lot of good resources in our community. We are so fortunate to be blessed with really great caring providers like Guinevere. So please reach out if you feel like you or someone you know can benefit from some of the services that we have here.
Yeah, and thank you so much. I was really very honored to come here. I love that I have you to refer my patients to when I've done everything that I know how to do and things are still not going well. Even when it's not like that, I often just say, I'd like you to check in with Dr. Okowski just so we know that we have all the bases covered. And it's lovely having somebody that I can work so well with. We are a very lucky community, and I really appreciate being asked to be here tonight and sharing patients. It's been lovely. So thank you.
Thank you for saying that, and thank you all for joining us at home. Have a great, wonderful evening.
Here is information for scheduling an appointment with Dr. Ochowski. You can use the QR code on the slide or visit the Midlife Services landing page on wellspan.org. And I also advise you to go to that landing page. Last month's chat was recorded and it is available for you to see on on that page. We are going to be recording every chat session, and as soon as it's been edited, we will upload it to our website so that you can view it when it's convenient for you. So I'm going to advance the slide because there is another one afterwards that tells you how you can schedule an appointment for acupuncture services throughout the WellSpan network. We actually have 7 providers who provide those services, which is really wonderful.